Hi and welcome back. I am at the Mallucci Clinic London with the owner of that name and the clinic. Hello Patrick.
Hi Nadine. Nice to see you.
Patrick and I have known each other quite a while now because Patrick runs the foremost well-respected aesthetic surgical clinic
It's a bit of both really,
in the
isn't
UK.
It
It is.
Yeah.
He is jack of all trades but master of quite a few as well. And what I thought I'd do with Patrick today is talk about, essentially answer your questions, which is everything you ever wanted to know about cosmetic surgery but were afraid to ask. So if you've ever thought about undergoing any cosmetical, surgical, aesthetic procedure but you didn't know where to start, this is the man who's going to answer those questions for you. So thank you for welcoming me to your clinic.
Thank you for having me.
Let's start off by just giving a bit of a background information, condense your CV and impress everybody that's watching.
Well, I've been in practice now for 20 years. I was in the NHS for 15 years and I've been in the private sector now for the last 5 years. My particular area of interest has been aesthetic breast surgery, everything to do with breasts basically. And I've been involved also very much at an academic level, so I've published a lot on the subject, I teach, I lecture internationally, and that's one of the things I enjoy doing.
Talk to me about, because a lot of people won't realise, so I know you as Mr. Patrick Mallucci. You're no longer a doctor. Explain to me how you become so well qualified you're no longer a doctor.
No.
So how many years in medical school at university?
Okay, so it's a historical peculiarity. So the way it works is you do 5 or 6 years at medical school and you become a doctor. Mm-hmm. Now if you then if you choose surgery as a specialty, you then undergo a period of surgical training. And
how many years?
So you do about 4 years of general surgery before then you choose a specialty. And at the end of your general surgical years, you take a surgical exam, at which point you lose the doctor.
Become a mister.
And the reason for that is that surgery has its origins, not in medicine, but with the barbers. So they were known as the barber surgeons, because of course they had the scissors in their hands. So in recognition of that origin, when you become a surgeon, you lose the doctor and you
revert to Mr., Mrs. or Ms.
Yeah, and so it's seen as a sort of an odd privilege.
Is it just in the UK?
Because just in the UK.
Because it's interesting because you see so many surgical doctors in America and they're still known as doctor, aren't they?
Yeah, and in effect, as soon as you're out of the UK, you are a doctor.
You are a doctor.
Because people just don't understand.
So you're not offended if I call you doctor, sir?
You can call me whatever you like.
Right, okay. Tell me why you decided to go from general surgery to cosmetic surgery, and are you happy with the term cosmetic or plastic or?
I think it doesn't really matter, to be honest. I mean, I think there are two sides to plastic surgery, and they are linked. They're not separate. So there's sort of the reconstructive side, and people may think more about cancer reconstruction or trauma reconstruction or congenital problems, and then there's the purely cosmetic surgery. But they are interlinked because when you're trying to reconstruct, whether it's a face or a body part or whatever, you are trying to do that in the best possible way using all the aesthetic principles that you do in aesthetic surgery. So the two are linked. And particularly for what I do a lot of aesthetic breast surgery, I do a lot of revisional surgery, people who've had lots of procedures done, and the techniques that you use are very similar to those for reconstructive. So they are interlinked.
Before we get off the subject of breasts, this is just my personal friendship group, okay? Have you noticed, I've now got more friends who shall remain nameless who've had breast reductions than breast implants. Have you noticed an increasing demand for breast reduction? Because I know you do that surgery.
Yeah, there's a huge demand for it.
Is there?
Yeah.
Is it beginning to outweigh?
I don't think it's outweighing breast augmentation, but it's extremely common.
I think I might have 5 friends that've had the procedure in the last 4 years.
The thing that I've perhaps noticed is that maybe people are coming forward a bit earlier than they used to. So there's a group of women in their early 20s who maybe and again, I don't have any data, but it's just we see quite a few. And I just wonder whether people, you know, like with all things cosmetic surgery, it's more in the open, it's more out there.
The mere fact that we're doing this
Absolutely.
video today says it all, really. And you're absolutely right. I have seen so many of my friends who previously would not have been seen in public without their top on, sort of going, look at this is amazing. And I go, wow, that's incredible. Do you know the one thing they will say? I wish I'd done it years ago.
I know.
I wish I'd done it years ago.
That's right.
I know.
So yeah, it's very popular.
And what made you decide to, because you're trained to do faces, as we said earlier when we were in the your surgical unit here, you can do liposuction, but what made you decide to specialise in breasts?
Well, I mean, really, it was. I just finished my plastic surgery training in Australia, actually, and I came back to the Royal Free and University College Hospital, London, and they didn't have a breast unit, so they wanted to set up breast reconstruction. So I sort of arrived on the scene when they wanted to get this underway. So that's really why I was sort of plunged into the world of breast, if you like. And it just developed from there.
I see, right, okay. Just really quickly, because I know this is going to be the one question, and I have put this out here in special honour. How does somebody know how to find a great plastic, cosmetic, aesthetic surgeon?
Look, I think you know, there are obviously the two main societies, which is the BAPRAS, British Association of Plastic, Reconstructive and Aesthetic Surgeons. It's a mouthful, but BAPRAS. Or there's the BARPS, the BAAPS, which is the British Association of Aesthetic Plastic Surgeons. So they are the umbrella organisations, if you like. They're the sort of the rubber stamps that when we go through our training, we get assumed onto. So I suppose it's a bit like the corgi stamp for
the
gas man. You know,
slightly underselling himself there, I think. But no offence to anybody out there. It's a corgi registered boiler fitter.
So they're the umbrella organisations. You know, ask your GP, ask around. You know, if you've got friends, you've had positive experiences, you know, see who they've been to. You know, you could. You know, today you can Google anybody, can't you?
Yes, you can.
You can Google them. You know, look at reviews, look whatever it is, and you know, also standard recommendation is go and see a few people. Don't just go and see one person. And it's often by seeing 2 or 3 people that you'll understand who understands you and what it is that you're looking for, and that will attune you further.
When somebody comes to see you for a consultation for any of the procedures that you might do, any of the surgeries you might do, can they expect to see a sort of catalogue of before and after photographs? Is that asking too much?
It's not asking too much at all, actually, and I think it's really important. I mean, I use before and after photographs as a means of communicating what I'm trying to do, or, you know, try and manage expectation of outcome, or it might be to show, you know, something negative, you know, to try and, you know, dissuade someone from doing something. So I think it's really important to see, you know, before and after. I mean, you know, it's your surgeon's work, you know, and if you don't like what you see, maybe you're not at the right, you know, with the right person.
I always advise somebody as well to ask to see somebody that is the same age as them, is having the same procedure, has the same body type,
I don't
the
treat
same
15-year-olds,
face type.
Nadine. I don't treat 15-year-olds.
Now, talking of which, who don't you treat?
Who don't you treat? Wow, that's a good question.
Are there any rules? Is there an age limit?
No, I don't think that. Well, I think so. Who don't you treat is a big question.
Okay.
And there's no one answer to this. If you're talking about age, I think younger women, you know, seeking cosmetic surgery, a red flag for obvious reasons. There are some situations where young women with perhaps congenital asymmetries, deformities, do actually warrant treatment, you know, much earlier than people might think. So, you know, mid-teens, etc. You know, if you're born with, you know, tuberous breasts or congenital asymmetry, you should be treated early because these are very important formative years, and you know, there's nothing to be gained by waiting until they're 18, 19 or 20. It's lost time for them. So I actually think that it's a very positive thing to operate on those individuals early. But if there's nothing wrong with you, then I think you have to be very cautious about operating in young women.
And the other end of the scale, can you ever be too old to have surgery?
Well, it's interesting. I had this,
how old is the oldest person?
I had this experience not too long ago, and I had a lady who came in, and she was 79 years old, and she was as fit as a fiddle. She looked fantastic, very elegant woman, and she decided, she for all these years she didn't like her breasts, and it came to a stage where I was sort of going through her, is there anything wrong with your blood pressure? Is your heart okay? You're sure it's okay? What about your lungs? You sure you haven't got you sure you need medication? Do you smoke? I was looking for excuses to say no, and I couldn't find any. And you can't really turn around and say, well, actually, you're too old. If you're fit and well, and obviously I consult my anaesthetist, and we all talk about it, we all discuss, etc. And age alone is not a reason.
Is smoking a reason? I noticed you highlighted that there.
Well, smoking can be a reason, for sure.
To not operate on someone.
Yeah,
okay.
and that's because there are consequences of smoking. So we know that smoking reduces your ability to heal, will increase your chances of having poor scarring, infections, poor post-operative recovery, even from a lung point of view. So smoking, it is a good reason not to operate.
And I presume you also want somebody at a fairly optimum weight, don't you?
You do, of course you do, and part of managing people sometimes is saying, look, now is not the right time for surgery. Let's get you right for surgery. So get them on a better lifestyle, diet, exercise, and get on a journey of reviewing them.
Do you know how many operations, cosmetic, plastic, reconstructive surgeries are done in the UK every year?
Well, one of the things we do know is that it's an increasing trend.
Is it still?
That's
interesting.
It's still an increasing trend. There are about probably between 25 and 30,000 breast augmentations done every year. Probably a bit fewer breast reductions. Eyelid surgery is the third most popular, and then of course you've got liposuction and everything else. So they're done in very, very great numbers. We know it's an increasing trend, in spite of Brexit, economic uncertainty, the high street not doing so well. People will invest in themselves.
Now, earlier on you showed me a little bit behind the scenes at the Mallucci Clinic London. You, even though we're not in a hospital, you actually offer cosmetic surgery day cases here. What's the difference between what you offer here and when you would say put somebody in a hospital overnight?
So
I know that's a big question.
Yeah, so this is, I suppose this is very much that the setup we have at Mallucci London is very much a US style setup, where under one roof you've got the sort of everything's surgical, but alongside all of the non-surgical, the non-invasive side. And the idea is that you've got this marriage between the two under one roof, and there's a lot of interchange between the two, which we can talk about. But within the setup, we have an operating theatre in which we can do cases under sedation and local anaesthesia. So
you do everything but general anaesthesia?
Everything but general anaesthesia.
Okay.
And you'd be surprised what you can do. And I think this has probably been one of our greatest positive learning experiences over the last couple of years.
So what can you do
with
sedation and local anaesthesia?
We do breast augmentations, we do breast lifts, we do liposuction, we do facial surgery, eyelids, fat transfer, you do mini tummy tucks. There's a whole bunch of things you can do, obviously taking away small lesions, etc., etc.
Yes.
And of course, what is phenomenal is the difference in recovery between sedation and general anaesthesia. It's like night and day. And
they all know I've had a general anaesthetic in the last week.
Well, I am not kidding when I say to you that, those who are appropriately selected have a breast augmentation, and in less than 2 hours after their procedure, they're dressed and walking home. So the recovery is phenomenal. They don't have any of the drawbacks of the general anaesthetic, the grogginess, the washed out feeling, etc. So, and again, it's something that I very much learnt from my travels in the United States in particular. I have many colleagues and I've been able to exchange ideas with, and this is very much a US model, and I think it will become more and more the norm over here.
And is it because the general anaesthetic is difficult to recover from, but also in some ways the riskiest part of any procedure?
Absolutely. I mean,
it sounds like a cliche, but you hear it, it's true.
It's true, and ultimately, if you don't need a general anaesthetic, why have one?
Don't have one.
It's as simple as that.
Is it a sort of hidden secret for men when they have cosmetic surgery?
Yeah, I think it's probably still a lot more hidden for men.
Okay.
Having said that, I think now that technology has got a bit better. So I'm talking about a lot of the non-surgical stuff. So for example, here we do cool sculpting, we do M sculpting.
We heard that earlier on.
Yeah, you can hear it.
I could hear this weird and I thought it was a laser. And Patrick said, no, that's M sculpting.
So one of the things we're noticing is that, this is, I don't know whether it's like a way of dipping their toe into it, but we're getting a lot more men coming in for the non-surgical, because I don't know whether they feel that they're not actually having cosmetic surgery, if that makes sense. But I find that they're surprisingly at ease with having some of these non-surgical treatments, which are now, of course, getting much more sophisticated and more effective.
What's the difference between surgical and non-surgical? I think I understand, but to somebody that doesn't know, well, and as a surgeon...
Yeah, and it is interesting because, like I said to you, under one roof, we have everything.
Is it oversimplifying it to say that surgery involves a scalpel?
No, it's not.
Sorry.
I mean, it does, but if you think about it, surgery involves organisationally much more.
Okay.
It is a procedure. You've got to be starved before your procedure. You've got to be, in good health, before it. You've got to be prepared to take a day out of work and a few days after that, or maybe a week or two, depending on what you're having done. The advantage, of course, is that it's immediate. Surgery is black and white. You go in and however many hours later you come out, something has been done.
I don't know what was going on there, but I just saw you go in, and his hands suddenly went like that. I'm not sure what he was taking away there or putting in.
with the non-surgery, it's completely different because there is no downtime. Basically, you can literally come in, in the morning and at lunchtime and afternoon. You're not taking any time out after that, but it's a much more gradual process. You might see a result after 8, 10, 12 weeks.
Be honest, is cosmetic surgery painful?
Well, I mean, it can be. It depends what you're having done. I mean, cosmetic surgery is a broad term, so you can have small cosmetic procedures, which aren't painful at all, and much bigger procedures, which are more painful. So, if you're having a big tummy tuck and pulling the rectus, that often is quite painful. It's well managed, of course, and there are ways that we can, reduce all of that. But a lot of procedures, smaller procedures, aren't particularly painful at all.
Again, my friend who had a breast reduction took 2 paracetamol afterwards.
Well, I was just about to say, one of the things that I always get, and of course there is a range, but almost, it wasn't nearly as painful as I thought it was going to be. And somewhere out there in the internet, there are a load of people writing about how painful it is, but the reality, from my experience, is that it's not as painful as people think it is. And most people will tell me after 2 or 3 days, I stopped taking painkillers. And that's a kind of average.
Is that a reflection on your skills, though?
Of course it is. No. I think anybody who's good and competent, should be able to deliver that sort of service.
What should you expect on the day when you have cosmetic surgery? So after they've been to a consultation with you, they've seen the befores and afters, you've chatted through the health implications, you've spoken to them about their lifestyle and all that sort of stuff, and they finally sign on the dotted line.
Yeah.
What happens on the day?
I mean, don't forget that we like to see our patients usually at least twice before surgery, because the process of becoming comfortable with having a procedure is not always easy for lots of people. So it does require a lot of thought and rethinking, and go home and discuss with a partner or family or whoever it is. So it's really important that process isn't rushed. But once they're decided, and there's good understanding between me and the patient, then, and as you say, they sort of sign their consent. On the day of surgery, they're obviously met either here or at the hospital by either the clinical staff or the nursing staff. People are taken to get changed into their pre-surgical gown. They'll get shown to their room. They'll get checked in by the nurse, so just basic pulse, blood pressure, make sure that they're well, nothing untoward. And then they'll get seen by me and my anaesthetist. And my anaesthetist will obviously sort of go over their health, will examine them, make sure that he's satisfied that there's nothing untoward. And then when I come to see the patients, I'll be there with my marker pen to draw marks on them. And the marks are really it's my surgical roadmap. Don't forget that when you're operating on people in the horizontal position, but people don't spend their lives horizontally. And so that marking is very important. It's an important guide for me, for surgery.
And then when somebody wakes up, where will they be when they wake up?
So then they go into a recovery.
Okay.
And during the recovery, they're essentially waking up, and their pain management is monitored, and that's really critical. Get on top of pain early, and then all their other vital signs, the blood pressure, pulse, make sure that all of those are normal. And as they wake up, eventually they'll start to feel thirsty, might start to feel a bit hungry, so we bring them something to drink, something to eat, gradually get them up onto their feet, supervised, and after sedation, that waking up process is very rapid. After general anaesthetic, it's much more gradual.
How much do people expect to pay for cosmetic surgery?
Look, it's a very difficult question.
Because somebody's there, they're going to ask.
Yeah, they will ask. So, and the answer is, it's very difficult to answer that, because there is so much variation. There's variation, within the country.
Yes.
So, like with anything.
So, city-based is going to be
in
more.
In London, it's going to be
okay.
more expensive than it will be, in Derbyshire or in any more provincial or rural setting. And then also within London, you'll get big variation. Now, I mean, the only thing I would say is be very wary that there's a lot of noise and competition around who can do it at the cheapest possible price. And all I would say is beware. There's a reason why people offer things at a cheap price. This is your body, it's your life.
And you do reconstructive work, so you see it go wrong.
You have to invest properly in yourself, and you would be better to wait, put off, save up for longer, and go to the right person who you can afford, than to go for the quick fix. Because often, as we know, that just ends up and spirals into disaster and more cost.
Is any, bearing in mind some of my followers, this is not going to mean anything to you, but if you're in the UK, is there any cosmetic, aesthetic, reconstructive surgical procedures that are available on the NHS? And obviously you used to work within the NHS.
Yes, I mean, the answer is it's more and more difficult in the NHS, to provide, cosmetic or non-urgent surgery, but for very obvious reasons, limited resources. So, people with, when I was training, we did quite a lot of breast reductions, we did a lot of breast asymmetry work, bigger, tummy tuck, abdominoplasty. These are they're fading out. as I said, you know, NHS has a limited resources, you know, and I'm not critical of the NHS for doing that. I understand the position, but it is where we are.
Right.
Well, I mean, I think going abroad for cosmetic surgery is potentially a very dangerous game, you know, particularly if you're seeking cheap cosmetic surgery abroad. You know, a lot of these sort of clinics who advertise low-cost surgery, you have no idea what the background of these surgeons are, what their qualifications are. You know, you're away from home. Ultimately, when you come back, you're at a distance from your carer, and these just goes against the principles of good medical practice. And I'm not talking about those who are seeking world experts and are making the appropriate plans in their lives to be treated by somebody remotely, and then sometimes there's a good reason for doing that. But it's really this concept of choosing, you know, cosmetic surgery at a price, at a low price. That's where it becomes very dangerous.
Because I know that people travel all over the world to come and see you as a centre of excellence. How long would you like them to be based in London if they're coming to see you?
That's a very good question, and I do have this conversation very regularly, and it's one of the things that I say to people is, look, if you're going to come over and travel to have surgery, and of course it depends on what that surgery is, you know, you have to make sure that you will put the time aside such that I can see you through your critical recovery phase.
Which is?
Well, it depends, you know, and if you're having lots of surgery, it might be a month. You know, for much smaller procedures, it might be 2 weeks.
But it would be 2 weeks minimum before you'd recommend flying, would it?
It really is, okay. You know, because I've got to make sure that they're healed, that all the early post-operative dangers they're clear of, that my nurses are happy with the way everything's healing, because otherwise I would advise them against doing it. You know, the same applies. I am no longer there, or my team's not there to look after them, and I can't send them away until I'm certain that, you know, they're well on the road to recovery.
Let's talk about healing as well, because one of the most common questions I get is, how can I avoid scars? Or how can I heal scars?
Don't have surgery. It's easy. When I talk about scarring to people, I talk about it in beneficial terms. You know, scarring allows me to create shape, to change form, to change position. You know, as I said to you, scars are the seams of my tailoring. So I actually look at it in beneficial terms. Scarring's not a thing to fear. It's good because it allows me to change things. In answer to your question, yes, there is a big variation between who scars well and who scars badly. Now, we understand some things about scarring, but there's an awful lot we don't understand. And, you know, in truth, however good a surgeon I am, however careful I am, if you're a good scarer, you'll always heal well. And if you're a bad scarer, you know, you're not going to heal well.
And how do you know if you're a bad scarer? Will you have a history of cuts and grazes and keloids?
You might do in rare instances. So true keloid formers are quite rare. And those are ones in whom whatever injury they have to the skin will result in keloid. But they're rare. In truth, you don't really know how you're going to scar, because the other thing that we know is that scarring varies between different anatomical sites. So you might have a lovely scar on your leg, but you might form a lumpy scar on your breast. Or you might have a lovely cesarean section, but not, or a lovely scar on your breast, but a lumpy cesarean section. So there isn't consistency in scarring throughout the body.
Is there anything that can be done for scars, surgical scars? Because obviously we were talking about the non-invasive. Can lasers be used now? Yeah,
I mean, there are lots of things you can do for scars. Even before you get to lasers, there are several sort of scar gels and preparations which ironically contain silicone. And for some reason, silicone seems to be good for scars. So you can start just applying massage and pressure to scars. You can simply tape scars. Even taping, the pressure of tape seems to be beneficial. You can add laser to that, and one of the things that's changed with laser is that we're introducing it earlier. So rather than waiting for a scar to be bad and then zapping it with laser, often that's a bit too late. So by effectively treating the scar early with laser. When I say early, I mean usually within 3 or 4 weeks of surgery.
Wow.
What you're trying to do is alter the wound healing environment such that they don't form the thick scar in the first place.
And is it some sort of Fraxel laser, is it?
There are lots of different types of lasers which are potentially beneficial for scars. Some fractionation, some which target more specifically, the blood vessel and the inflammatory process. But the key is to get in early rather than late. The quicker you can modify the wound healing environment, the better.
If you weren't a cosmetic surgeon, aesthetic, plastic, reconstructive surgeon, what would you be?
I'll be a footballer. That's what I'll be. Yeah, I'm still.
Is that in your other life? Is that what?
In my other life, I'm still waiting for Jurgen Klopp to pick up the phone and say, "Listen, we need that extra midfielder."
I would like to say on behalf of every single woman, some of whom I know that you've worked and operated on, thank you, Jurgen. Go away. Leave him to us. Thank
you. My number.
Patrick Mallucci. We are at the Mallucci Clinic. I'm going to put all the details of everything Patrick does below. Did you notice he didn't actually talk about money in terms of thousands of pounds? But trust me, the best surgeons in the world, actually, the minute I said that, my shoulder started to itch as it's healing. The best surgeons in the world are absolutely worth every penny you're going to pay for them. Thank you for watching. Thank you for subscribing. I should put the details of all of Patrick's clinics, his nurses, his nurse practitioners, all the treatments they do, but also Patrick himself, so that you'll know where to find him.